let's talk about CHF, or congestive heart failure. I'm only going to speak about that because I experience that on usually a daily basis with my patients. Again, this is for educational purposes only. It's not for you to go diagnose anybody. They already are diagnosed when you see them. Normally, these patients have something called edema, which is in the lower extremities, which is a collection of fluid. So usually as a nurse, you want to assess your patients. You want to listen to their lung sounds, because some patients don't present with edema of the legs. Some of them have it in the abdomen, some collect fluid in their lungs. So it's important that you weigh your patients daily, or if you don't see them daily, we'll have the patient document daily their weights. If they gain anywhere from 2 to 3 pounds in one day, you want to report that to the MD. If it's 5 pounds in a week, you want to report that to the MD, because then we'd have to switch, not we, but the doctor will switch the diuretic. Usually it's furosemide, sometimes it's torsemide. It depends. Sometimes prolactinone, bumetanide. It'll get increased temporarily so that the fluid can come out. Otherwise, the patients can have an exacerbation of CHF and end up in the hospital. So we tend to observe them very well. Again, there's edema in the legs. Most of them present in the legs. You would just pit. So you want to put your finger down, press on them. If it pits at the top level, then that's a +1. The deeper you go, then it'll be a 2, 3, or 4. Again, those are things, if it's out of the norm, you want to report that to the MD or the ordering provider, whoever placed the orders. And the patients, always want to teach them that if they're on furosemide, which is a non-sparing diuretic, which means that potassium leaves the body with the urine, then you want to make sure that they're not having any type of muscle spasms, because patients tend to have muscle spasms, which then means that the potassium is low. You never want to have your potassium too low or too high, because it can cause cardiac abnormalities, which you don't want, okay, because it can cause a heart attack, basically. So the normal potassium is 3.5 to 5. That's normally the range, depending on what hospital or which hospital you work at. That's normally the range that you go by. So if your patient experiences those type of symptoms, you want to make sure that they're eating enough potassium-rich foods. So normally bananas, but you also want to report that to their MD so that they can follow up with blood work and make sure that they're fine. Sometimes they'll put them on an EKG to make sure there's no changes in the T waves or their ST waves. But as far as CHF, it's chronic. A lot of people have it. Always tell your patients to elevate the legs. A lot of people elevate them just normally. You want to always elevate above the heart so that it can circulate towards the heart and you can use the restroom and get rid of. Again, also for furosemide or any type of diuretic, always give it in the morning, because you're going to urinate. So if you give it to midday or night, the patient won't sleep. All right. Thank you.